We are going to go now to Dr. Janine Hubbard, clinical child psychologist. Hello.
Good morning, Linda.
How are you this sunny, warm morning?
Oh, it's amazing how that nice weather does everybody a little bit of good. It may be hot, but you know what? That sunshine just cheers everyone up.
It does. It exposes a lot of dust in the house, I noticed.
Yes.
You don't tend to notice it on those dreary days, and then all of a sudden the sun is shining in and you're like, oh my God, when was the last time I did that? Oh my. But that's not why you're calling. Towards recovery, and I know this is something that Patty Daly had been bringing up last week in the latest evaluation report, and how lacking it was in certain areas. We're looking for your opinion on that.
Certainly, and my apologies to Patty. Last week was a bit of a chaotic week, so I wasn't able. Normally, I can drop everything and find time for him, and my schedule didn't permit. So I guess we're continuing the conversation on to this week, because I think this is one that, I have a strong attachment to. Actually, one of my first big government presentations was to the Towards Recovery Committee back in 2015, if you can believe it, on behalf of APNL, and talking about some of the concerns and gaps in services for psychologists, and where we saw that psychologists could be better used within the system. So that was a long time ago. So first thing, I want to give a major shout out and kudos to the many, many, many people who were involved in all of the subcommittees trying to produce this document. There's no question that there was a tremendous amount of work that has gone into it. And there have been some really significant victories. I think back to 2015 and things like the increase in the mobile crisis units, things like some of the availability for short-term initiatives, for same-day services. Those are things that really either didn't exist or existed in very limited use back in that time, not to mention some of the online things, which, of course, technology and COVID and all the rest of it has significantly sped up. So, I think it's really important to talk about the fact that there have been some major accomplishments made before kind of getting into some of the criticisms.
Well, indeed. And I've heard some people say, the short-term measures and the short-term actions appear to be there, but what about the long-term? Because that's where we're really seeing some failures, I suppose, in the system.
Yeah, and I guess, and this is probably very naive of me, which is why I'm a psychologist, not a politician, one of the things that was remarkable about the all-party committee was it was just that. It was a collaboration from all sides of the House. All of the political parties were involved, and in many ways they kind of set the politics aside and said, we have a province that's really suffering. We have to address the fact that we have some major deficits. Let's work together. Let's work really cooperatively and collaboratively together. And unfortunately, when you then get this kind of report, it takes on far more of, kind of the political gesturing or grandstanding, and as opposed to sort of saying, hey, we've done some really great things. Here are some of the things we found. Here are the accomplishments we're proud of. But you know what? Let's acknowledge that we have a long way to go in a lot of places. And we also want to be far more transparent about that. I mean, I think a lot of people have talked about those pages of checklists, and that doesn't give me any meaningful information. It doesn't tell me what it is you did to accomplish that. And, again, can we go back to the making it more collaborative, reaching out to people? It's interesting. I know they did a lot of evaluation of services and reached out to some very targeted groups. We were one of the groups who presented way back in the day, and I can tell you, to the best of my knowledge, APNL, so all of the Psychology Association, wasn't contacted for feedback. And we know that many of these recommendations have had a real impact on psychologists and psychology services.
So what were among some of the concerns that your association brought forward?
Well, I mean, I think there's a few things that, I remember raising the day the report was released, and because there was a real emphasis and focus on wait times and wait lists. And what I wanted to see was meaningful reductions in wait times and wait lists, because we know that in many programs and many services, they stop taking a wait list. That's not a meaningful reduction in waiting times for people. We'd like some information about how some of this program evaluation was done. Was it just people who completed programs? Was it people who were offered the programs and declined? Was it people who participated briefly and then dropped out? Psychologists tend to be kind of geeky about our research and our program evaluation, and those are really important questions that tell us so much more about what has been happening. So knowing a bit more about that, it's interesting when I said, even in terms of some of the details, one of the things that was in our report back in the day was looking at increasing insurance plans, whether that was for government employees, whether that was making sure that contracts with the provincial government, that those companies were providing their employees with really solid insurance plans. One of the checklists says that they've been working to improve insurance plans, but I haven't heard any details on that, and again, would love to hear some of the specifics as to what that's looking for, because that's one of the things we've been advocating for our public sector psychologists is better mental health support for our own. You and I have talked about that in the past.
Well, yeah, and one of the things that we've talked about at length in the past is the Association of Psychologists in Newfoundland and Labrador has been talking about this hemorrhaging of psychologists from the public health system. How are we doing with that?
I would say it's stable. But stable, and again, this is all public sector, so education, health, and post-secondary. The hemorrhage that we saw as talking to our members, a number of them pointed to some of these initiatives, some of these plans, some of the lack of consultation before implementing some of the plans as reasons why they left the public sector. But certainly in many places, we're still hovering around 50% vacancies.
And, of course, that affects access and waiting lists and the like?
Absolutely. And we, again, acknowledge very openly, there's been some excellent work done in terms of recruitment initiatives. There have been some issues around, like, market differential to try to address some of the issues for existing psychologists, but I think we've got a long way to go in terms of the retention initiatives, and that's, again, a message that we have heard repeatedly from our members and that's a much tanglier and much more complex issue to try to address, as opposed to a sign-on bonus. Those are easier and faster to be able to deliver.
Dr. Janine Hubbard, I do appreciate your time this morning. Thanks very much.
Well, thanks so much. And like I say, big shout out to all the people who were involved in this. I just wish maybe we could put the politics aside and have some really candid conversations about what needs to happen next and be brutally honest about it, because it's only going to help the population of this province for us to be open and transparent and work together for some solutions.
Thanks very much.
Thanks, Linda.
Okay.
Bye.
Bye-bye. Dr. Janine Hubbard with the Association of Psychologists of Newfoundland and Labrador.